Welcome to Just Therapy, the podcast where we dive into mental health, family, faith, and living with traditional and conservative values. Whether you're looking for practical advice, seeking clarity, or simply want to strengthen the foundation of your life, you're in the right place. Together with fellow counselors, we'll tackle tough topics, answer your most pressing questions, and explore how traditional values and modern care can work hand in hand to build stronger, healthier lives. Please note that the content provided in this podcast is for informational and educational purposes only and is not intended to replace professional mental health care, diagnose, or treatment. Always seek the advice of your own licensed mental health provider or medical professional regarding your specific situation. While I am a licensed marriage and family therapist and my guests are also professional counselors, the discussions in this podcast are meant to offer general insights and should not be taken as personalized therapeutic advice. Listening to this podcast does not establish a therapist-client relationship with me or any of my guests. If you are experiencing a mental health crisis or have thoughts of harming yourself or others, please contact a mental health professional, call 911, or go to the nearest emergency room immediately. You can also reach out to a crisis hotline such as the Suicide and Crisis Lifeline at 988 in the United States for immediate support. Every individual's journey is unique, and what works for one person may not be suitable for another, so please use discretion and seek appropriate care as needed. Well, hey, Jay, welcome to Just Therapy. It is so great to have you on the podcast this week.
Thank you so much, Lisa. Thank you for having me, and I'm excited to have these discussions that we're going to be talking about today.
Yeah, and before we get too far into it, you have your own podcast, so give that a shout out.
Yes. So I have the Mind Works podcast. It's
Okay.
basically a podcast that's a little bit more. It gets a little political, but it also is very therapy oriented and just very psychoeducational.
Awesome. Well, will you share with our listeners a little bit about who you are, what you do, and how you help people?
Yeah. So my name is Dre. I am a mental health counselor in Queens, New York, and basically I help people through many different interventions. I'm actually one of those therapists that has a very dynamic approach. Like it really is subjective to every individual because everyone's problems are different. So I feel like sometimes somebody might benefit from a combination of interventions like psychoanalysis, the CBT, the DBT, all this stuff. So basically, yeah, that's how I help people, I guess.
Okay.
And I'm also a teacher. I also am an adjunct lecturer of psychology at CUNY schools. So I also teach psychology as well.
Nice. Nice.
Yeah.
Awesome. Well, I'm so excited to have you here. We were just chatting before we hit record, and I know I might have to have you back because you have a lot of different things that you can share with our listeners. But I think today it would be really a great topic to talk about pornography. That is
Mhm.
a really important topic for people nowadays. Where would you like to start?
I mean, I guess like we could start off because I was just having this conversation with a friend the other day. This friend was a past friend of mine. He did have drug addiction and
Mhm.
stuff, and we kind of talked about pornography addiction and labeling pornography as an addiction. Like what makes an addiction an addiction? His was more severe, where he was doing things that were obviously inappropriate to get money to fund the drug habits, right? So do people go to that extent of an actual like heroin addiction or a pill addiction or whatever the case is in similarity to a pornography addiction? That was the question.
Mhm.
I told him because he got very overwhelmed when I started talking about some people have these porn addictions and stuff. And he's like, those people don't really know what addiction is because it's like whenever you get to a point where you gotta like either do something or lie to people to get what you need, that's like an addiction and whatnot.
Right.
But I told them, it's like, well, you had this addiction before. Maybe there's a little bit of projection in your statement from your experience. However, sometimes, like, I think comparing a porn addiction with like a heroin addiction is like comparing apples and oranges. You can't really
Sure.
compare the two. And so we started talking about that. And I do feel like obviously porn addiction can affect somebody in obvious different ways. And I've had clients that have come to me and told me that they've had instances where they felt very tempted to masturbate while at work or going to the bathroom and letting it out or whatever the case is, and how it affects their relationships, how it kind of like distorts their view of their own relationships and things like that. So they report all these different problems, obviously not the same as like a heroin addiction.
Right.
And I guess another thing is that when people come forth with these pornography addictions, they're not necessarily there to lie about it. I think when you do rehabilitation counseling, like a drug counselor or whatever, you are more likely to hear a client who is addicted to drugs probably lie about their use to get past probation or whatever it is that they're going there
Right.
for. But when it comes to pornography addiction, it's definitely very different. And now, if we're getting into that, the pornography addiction is interesting because I don't know if you've been hearing things about the DSM-6, the Diagnostic Statistical Manual of Mental Disorders from the 5 to the 6. But now it's interesting because many psychologists, and I don't know if you heard this, but they're kind of like trying to put a lot of these mental health disorders on a spectrum. So, for example, like ADHD, mild, moderate, severe.
Right.
I have a lot of thoughts about that. I mean, that's
Mhm.
a whole nother discussion. But I guess if you kind of take that and you apply it to the pornography addiction, there could be a mild
Yeah.
addiction, a moderate addiction, and then you have a severe addiction. And I think as a clinician, it could definitely help us really work with the client if it's put into that type of framework. But
Right.
then you have all the political stuff like how are insurance companies going to bill for these services if like there's a
Yeah.
mild pornography addiction versus a severe one? You know what I mean?
Right.
Like so it
Right.
gets very technical.
Yeah, it does. And I guess I worked in addiction recovery for a couple years after grad school, probably about like when was that? The late 2000s or around 2008, I guess. I worked as a family therapist in addiction recovery. And it is whew, yeah, a substance abuse addiction issue is very different than a sex addiction or pornography addiction. So I totally get what you're saying, apples to oranges. And one of the things that comes to mind is a lot of people don't think that it actually is an addiction. I guess it depends on the therapist that you talk to, but they'll say sex addiction isn't really an addiction. And my thing is, if it's getting in the way of daily functioning and getting in the way of having healthy relationships, then it's a problem. I don't care what you call it. We can call it whatever makes you feel good about calling it. Let's call it that. But
Yeah.
if it's getting in the way of your relationships, your marriage, your work,
Mhm.
functioning, can't get through the day at work, then it's a problem. Then we got to talk about it. So I totally get the whole DSM criteria. And for those listening, the DSM is what therapists, counselors look at to help make a diagnosis as to what's going on when you present for counseling or therapy. And to get insurance to pay for your counseling, we have to diagnose. Now, that's a whole other podcast to begin with. And this is why I don't want to put a diagnosis on anybody if I don't have to, because
Yeah.
fun fact, y'all, that diagnosis can stay with you. And and I'll stay with you as you go, possibly if you ever have a gap in insurance and then you have to reapply. That's a whole other podcast episode. So think about that, y'all, when you're asking for a diagnosis. But besides the point, yeah, I mean, the whole porn addiction, sex addiction
Mhm.
is tough. And I don't think people talk about it enough. I don't think that there's enough information out there because a lot of people are silently suffering with this.
A lot of shame associated
Mm-hmm.
with it. No one goes around talking about how they watch pornography with,
Right.
people randomly. It's not like a normal thing. There's a sort of like shame component to it. And
Sure.
yeah, like an interesting thing that you said was it depends on the therapist, right? Because there are therapists that would say something along the lines like, "Oh, masturbation is normal. It's like what we all do it." Like, it's like,
Right.
are you disclosing something there that you're probably not supposed to be in the counseling session? But but
Right.
this is the type of things that you hear, I guess, from other therapists, maybe.
Yeah.
And sometimes it's, I guess when you think about it and you look at the research in terms of masturbation, like what is a healthy amount of
Mm-hmm.
masturbation or pornography viewing? What defines it to be healthy? These are questions that I think need to be answered with some sort of research or some
Mm-hmm.
sort of like a statistical basis of something
Yeah.
sort.
Yeah. And I don't know. I mean, I don't know what is considered, quote unquote
Well,
normal. Do
well,
you? I
when
mean,
I
do you have that
Well, I
info?
mean, like when I work with clients that have it, the things I typically find that they're suffering with is usually their
Yeah.
relationships, like their partner. And usually it's the men coming in and their partner, who's a woman, is like saying, I don't like this. Like, this is disgusting. Like, I feel like you're cheating on me with
Mm-hmm.
this fantasy porn star and whatever the case is. So a lot of it does come from, I guess, the environment, as that makes it a problem, as I
Mm-hmm.
think a lot of these
Yeah.
disorders kind of do. So, and it's interesting because I don't even think there is porn addiction in the DSM-5.
No, there's not.
There's
No.
not.
No.
So they don't even know what makes
Right.
it a problem, but you see people coming in for this specific issue and wanting to work on it.
Yeah.
And I basically provide that safe space for us to talk about it. And I guess I don't know if there's a gender I guess difference, and like, I mean, there is a gender difference in masturbation rates and whatnot. But I mean, like when it comes to being a therapist, like do men feel more comfortable expressing this with a female counselor or a male counselor? That's a whole nother topic. But it's an interesting thing. That's usually what I see it. And then I see like another thing that they come in with is not just like their relationship problems, but their frequency of how often they're doing it. Like,
Mhm.
obviously if they're doing it 2 or 3 times a day, every day out of the week, and then and I also hear like them expressing things like, I had to really surpass my stubbornness to come here. Like,
Mm.
I do not want to be here. I don't think pornography is affecting me in that negative way or my usage of it. So it's kind of like, but then they're like, my partner is telling me that she doesn't like it, it's affecting me. And it almost seems like they're basically here because their partner is telling them that
Yeah.
they're not okay with it.
Right. Yeah, I think a lot of different reasons are going to bring bring people in to therapy, to counseling, and I guess ultimately the patient or client has to decide, am I here to check the box because she asked me to come, or am I here because I want my life to be different?
Hmm.
And that is not something that we can, as the counselor, as a therapist, like, we can't change that person's mindset about it. They have to come in telling us what they want to be different
Exactly.
or to
Yeah.
change. Yeah, it is and I also wanted to point out too that with pornography use, if I haven't come across pornography in a while. It's usually more of like, well, I guess let's say like sex addiction issues, but it's, was it related to trauma? Is it related to abuse? Is it related to some type of unresolved issue that the person has that they haven't fully processed? I mean, there's a lot of different reasons why pornography becomes, like, I'm going to say, the drug of choice
Mhm.
for people. So it's kind of hard to pin down exactly what it is. But if you are dealing with pornography addiction or overuse, then there is, of course, help out there if that is something that you want to be different with or change.
Yeah. And you see, you're correct. Like in my own, whatever I'm saying, just be mindful of generalization, right? Like I'm
Yeah,
not generalizing this to every person that
right.
has an overuse or an addiction they feel to pornography. It's many different factors. Every time I get a client coming in for it, it could be sometimes it could be conditional. It could be, from a very young age, started
Right.
masturbating at a very young age, like we're talking like 12, 11,
Yeah.
10 years of age, started masturbating then and kind of developed this habit. So it could be a condition. There could be media influences, like I guess like a lot of media influence could promote hypersexuality or exploit, women, I
Mm.
guess, in certain ways that might cause a man to feel like this is what it is and stuff like that. So there are so many different factors, biological factors I'm probably not even aware of because I just do the psychological aspect. I do
Mm.
more of the mental, so basically the psychosocial stuff. But I'm pretty sure if you looked at the neurology of people that use pornography, their brains are probably like altered
Yeah.
in their development from constant pornography use. So it kind of like shapes them to make this almost like a normalcy. Like this is just a normal behavior.
Yeah. Yeah. So the people that come to you for this type of help or this type of treatment, like, what is the I guess the length of treatment usually look like? Or what type of treatment, or how frequently, the length, um, prognosis, would you say?
So typically, like the length is about maybe like six. I start seeing results after maybe typically on average about 6 months of therapy, kind of.
Mhm.
A lot of the interventions, I guess it's dependent on the interventions and if the client is, doing them. One intervention that actually I feel like works with a lot of clients in this regard is typically writing down the reasons as to why they want to stop masturbating to pornography frequently and having that sort of list in their, I guess, where they typically normally do it. Maybe it could be their bedroom or whatever the case is. Some people have kept this list in their pockets or whatever the case is. And the list is basically, and like I tell them, write the list of things, that reasons why you want to stop. And a lot of this list promotes a lot of shame and guilt feelings. So it is kind of like I use guilt and shame. And I know like many supervisors or other therapists may actually look at this like it's not a good thing to utilize someone's guilt and shame to change behavior. But I feel like, I look at it like there's some power in that. You know
Mhm,
what I mean? Like, I think we as people don't recognize our guilt and shame because we're prone to basically putting it to the side, because it's a very hard feeling to deal with and face when you're kind of like ashamed of something. You try to look, I think we have a natural inclination to look the other way of things that we're shamed about. We don't really go towards shame,
mhm,
and kind of like address it, or, and it's situational too. Like, I'm not saying this will work for, a shame of like a certain a particular situation, but with pornography specifically and pornography usage, I think having like a list of the things that these are the reasons why I want to stop. Clients have came to me, brought their list in like a tangible
mhm.
thing. They'll kind of like fold it, or they keep it like in a safe place, whatever the case is. And whenever they get the temptation to masturbate or watch pornography, they pull out the list. And the list is like a sensational, I feel like there's a sensational component to it, like the feeling of it, the vision of it. Kind of like they'll look at the list, they'll read it, and then they'll start to feel shame. Like usually on the first thing, it's usually like partners heartbroken by my usage of this. I don't like the way it like smells afterwards, or I don't, it's a shameful act because I feel, so like
Yeah,
they'll look at this list of things that they created on their own, and they'll kind of open it up, and I get kind of good feedback on that
yeah. Well, it sounds like
approach.
you're like addressing the shame, you're addressing the guilt, and these are valid feelings. And like you said, if the if we just want to push them down and we just want to ignore it, then you're never really processing your truth. You're
Yep.
never really getting to the core issue. And it is the shame, it is the guilt, it is the fear, it is, I mean, all of those things are gonna, you know, if they're not addressed, then they turn into symptoms, and symptoms can become pornography addiction. It can become drinking. It can become drug use. It's like you funnel those feelings into something, because when you start to feel the shame, you got to do something that takes
Yeah.
away that feeling, because it doesn't feel good. And I think that right now our society is like, oh no, you have to be happy. Whatever makes you feel good in the moment. But we're just totally throwing aside the fact that, well, why do we have to feel so good every minute of the day? What are we not addressing? And so
Yeah.
I think that's a really that sounds like a good intervention to me. And I think that from doing this work for so long, it's like that's what I see too with clients when they finally are able to talk about the shame, when they're finally able to talk about their deep-seated fears, that's where the work happens.
Yeah,
So,
in a
yeah,
safe space, in a very safe
exactly.
space. It's
Yeah.
like there's no judgment here. Like I said in the
Mhm.
beginning, or before we were talking, like one important thing with clients that you have to do as a therapist is, like I said, it is like when you are able to provide a genuine sense of respect for what they believe, separate from your own biases. I think the clinical work becomes so much more effective.
Right.
It's like, because and this is the type of training they do in, when I was in my master's program. This is the type of training they provide to us. It's like you have to write your own 30-page autobiography, a self autobiography about yourself from childhood to adulthood and where you're at in life currently. And I feel like those are the type of assignments that are necessary for therapists in order to like be able to have respect for the individual you're working with, even if your sort of bias is different from theirs. Because I mean, I'm in New York City, so like I have to do that a lot, and um you kind of have to have that respect. But at the same time, do you agree with these clients? No, you can disagree, but on your own time.
Right.
Obviously you respect it, but obviously it's like if I did agree with everything all my clients said, I'd be crazy. You know what I mean?
Right.
Like, I mean,
We'd be all over the place.
yeah, we'd be all over the place. So as
Yeah.
therapists, people need to understand that we have to protect ourselves too, like,
Hmm.
because this work is mentally draining.
Hmm.
I think people really come into, trying to look for a therapist, and they really want those therapists to align with their values and their viewpoints. But I will recommend clients and people out there that are probably listening to get the therapist that you probably may not align with viewpoints, because you might actually learn a lot more, and it'll probably and it's not even about our biases or our viewpoints. It's not even about that. We as therapists, we're trained not to implement our
Right.
biases into our therapy sessions. So it's really a matter of, choosing a therapist and seeing what comes out of the work. And many people make it seem like a dating game, which I think it's like that's a whole other topic as well. But just bringing it back to the conversation, yeah, a lot of people promote like if it feels good, go ahead and do it. It kind of promotes a lot of like the hedonistic type of ideology to live by. Like, just pursue pleasure, screw everything else type of thing.
Right. Yeah. It's such a selfish way to live in this world.
Mhm.
So if it's all about me, and what I want in the moment, it's like you're missing out on being a part of community, of being part of I mean, I know. And I think some people would probably say, well, no, that's not the truth because that's not true because, I'm an activist for this and I'm an activist for that. But, it's like you still have to I always say, like, when you're starting to feel bad or you're starting to feel, a mood come on, the best thing you can do is get out of yourself and go serve somebody else or go volunteer or go be around people. And I think we're just wired to do that as humans. We need each other. We need to be there for each other. And I'm not saying like, of course, have your boundaries and have your limits, but I don't know what I'm trying to say. But I guess I just feel like a lot of the times these days it's promoted to be it's about your happiness, it's about what you want, it's all about I just want you to be happy. And yeah, I want you to be happy, but I also want you to have resilience, and I want you
Yeah.
to know why we have like suffering isn't doesn't feel good, but it makes us stronger human beings. It grows us. It helps us kind of get to the next chapter in our lives, and there's a reason for having to suffer. Of course, I don't want anybody to suffer, horrible things, but
Mhm.
if you're not where you want to be right now in your life, you can grow through that. Like this is a lesson for you. It's not like, oh, woe is me. Everything's kind of might feel that way right now, but how can you use this as a learning and growth opportunity? I know I just kind of went off on a
Exactly.
tangent, but
No, it's okay. There's a lot of things that were running through my mind as you were
yeah,
talking. I guess like what you're associating this is like a sense of individualism and how it kind of like perpetuates this idea of me
yeah,
type of thing. And then another thing that you're talking about is being able to go back and give into your community. And I think that's related to like Eric Erickson, like his theory on psychosocial stages of
yeah,
development, where he says like at some point in life, I guess in your like in your 50s or something like that. It's like generativity versus despair, and like I guess generativity, or is it stagnation or despair, whichever one.
mhm,
But generativity is about like, yeah, giving back to your community
yeah,
after a certain period of time that you've worked on yourself.
mhm,
And the individualistic culture definitely promotes that type of ideology of like the opposite of generativity to some degree, because
right,
it is about me, and things like that. And to do things for your own sort of guilty pleasure. And then you spoke about, I guess, like activists being like, oh, yeah, well, I do this to help others and things like that. Well, I mean, when you think about it, you get pleasure out of that, right? I mean, it's pleasurable to yourself. And so are you really doing it for them, or are you doing it because it does sort of induce you with some form of pleasure because you're doing it. So,
yeah,
it's like kind of it gets very existential,
yeah,
and I think that's like where you go into with all this stuff. It's like, what is meaningful, and I think there's suffering in meaning. There's meaning in suffering,
sure,
because um yeah, all these people that I've worked with, I've seen their struggles, and even like with the pornography addiction thing, like I always tell clients also another intervention I use is I throw in some existential intervention, and I talk to them about, how has this sort of problem, this pornography usage or overusage or addiction or whatever you want to label it as, how has it brought meaning into your life? And that's like one of the biggest um things within that therapeutic process is talking about how did this develop some form of meaning within my life that doesn't keep me at home miserable and just moping in my own depression. It has brought some significant meaning. It has motivated me to change. It has
right,
created some form of a need in order for me to satisfy. And I guess that need is truth and being a part of my own truth. And I'm not I don't like to get religious or anything sometimes on these interviews, but like, there is a verse in the Bible, it's John 8:32, where he says, the truth will set you free. And I do feel like that that verse or that statement has really been significant in the work today,
Mhm.
because many people are not living in their truth
Right.
within their own shame that they truthfully feel. They try to avoid that. Many people don't live in their truth of who they are, kind of in a way. They try to avoid that. And and I guess that's where this topic might leeway into, gender topics to some degree, I guess, and things like that.
Yeah, I know. And I love that. The truth will set you free. I was just thinking about this, uh, that concept the other day.
Mhm.
I'm a mom. We
Mhm.
have two daughters. They're teens.
Oh boy.
And yeah, dude, don't get me started, y'all. Oh, but my husband and I are always talking about, well, we talk a lot about parenting and raising our kids and stuff. But it can be really hard and difficult at times. And it would be really easy for me to just, eh, when I'm feeling overwhelmed, just to like do something that makes me feel good in the moment. Like maybe I want to just get on Instagram and scroll for an hour, or maybe I want to flee the house. But the truth is, my truth is that is like an escape mechanism from dealing with what's going on under our roof.
Mhm.
And I see that happening a lot with my peers, women
Mhm.
my age who are going through similar things. And the truth is, if there's things going on under your roof that need to be addressed,
Mhm.
seriously need to be addressed, then you as the parent need to address them. And it's hard because it's hard work. And I'm just kind of speaking in a little bit of abstract here, but I
Yeah.
just want to put that out there because I think it's really important that, and it'd be really easy to escape with something. Not that I'm going to pick porn, but it would be really easy for me to pick something to escape. I could drink more wine, I could go spend more hours away doing something because I don't want to address what's going on in our home. So I think that's something
Mm.
you have to look at the truth, because the truth is freedom. When you accept the
Mhm.
truth, even if it's hard and you don't know what to do with it, just be honest with yourself and say, this is what's going on. And how do we change this? How do we move through it? What kind of support? Where do I go? How do I how do I fix this within our home? I just feel like that message is I really wanted to address that
Mhm.
because it's common, especially I think as your kids get older. When they're little, it's very different. But as they become teens and they have opinions and ideas and they're learning things in school, and you're like, whoa, wait a minute, let's talk about that as a family. It can be so much. And
Yeah.
it'd be so easy just to go escape,
Yeah.
and not deal with the truth.
And that's an interesting point, I guess. Is it like is I guess is escapism a coping mechanism? Is it like something that, should we be applying escapism in our ways of coping with stress? That's a interesting question. Um yeah, like cuz I feel like sometimes, even let's say for example, when you talk with a client and you're what are your coping mechanisms for this work related stress? Oh, I like to go to the gym and blow off steam, right? And it's like, okay, is that a form of escapism from the actual problem? Or is it just there to help you kind of cope with what's going on in that moment? So I do believe, I would say like escapism, putting that label, I guess it's kind of, do we have to compartmentalize escapism and coping mechanisms? Like what is
Mm. Yeah,
healthy? Because it's, I think like even myself, like, yeah, if I'm stressed, like I said, I'll go to the gym and,
right.
go work out or something. Am I escaping from my responsibilities, right?
Right. Yeah.
And I think when I guess we have time, right? Time is relative. So, you have time to do that. And I believe, I personally believe, it's a healthy thing to some degree to like kind of, if you want to scroll, go ahead and scroll. But yeah, I think there has to be a boundary within those coping mechanisms, because I think then that will promote some form of personal responsibility to your things that you have to get done, and I
Hmm.
think that would be helpful. So I think it's maybe about setting boundaries within coping mechanisms, because some of these coping mechanisms, they could become like a form of if we're talking like defense mechanisms, like a form of sublimation, right? Where you're
Right.
kind of like sublimating, where for those that don't know, it's like sublimation is a defense mechanism whenever you're stressed out. you unconsciously go and do something productive without realizing. But the problem with that is that you're not actually addressing the
Mhm.
stress that's causing you to sublimate. I guess some people will argue that's a good defense mechanism because your production is stimulated by
Yeah.
stressors.
Yeah, but I would hedge a bet that
Mhm.
that's going to show up in other areas of your life too. Like it's you might be able to like move it around over here with exercise, but that the anxiety or trying to cope with the anxieties maybe shows up in a different way somewhere else. Because if you're not ultimately addressing it or getting to the root, it's going to keep popping up, and so it's going to be like whack-a-mole almost, you know.
Yeah, yeah, no, that's
Um,
true. Yeah, it's like a
yeah.
yeah. Mhm.
Yeah, I was just so I'm reading Atomic Habits, and one of
Oh
the
yeah,
things
yeah.
they talk about is you have that behind you? You probably do in all your amazing
I
books.
mean, I have a habit. Oh, no, I have the power of habit actually.
Yeah, I think I have that one too.
Like the
Um,
power habit by Charles Duhigg.
yeah, I have that one too. And he actually
Hey,
he talks about that in Atomic Habits. And one of the things in Atomic, and I was just reading this yesterday, it was about how to creating a healthy habit versus trying to stop an unhealthy habit. And I remember one of the things in there, he's explaining the cue, trigger, response, reward cycle, which is in the book you just had. So it's you have to be mindful of what's your ultimate reasoning for doing this habit. Is it to reduce anxiety? Is it to escape? You
mhm.
have to be very aware of your
Your
of what you're
why.
doing. Yeah, I mean, this is a really cool conversation. I'm really enjoying it. You're gonna have to come back on the podcast for sure.
Yeah, yeah, it's a lot. I have a lot in my head. Like after years of teaching, it's just all there, you
Sure.
know. It's
Yeah,
like a
I
lot.
imagine your students are learning a lot from you. I know you and I both
Mhm.
have to run to go
Yeah.
see a client. So, what else? One more time, how can listeners find you if they want to connect with you or learn more?
Yeah, they could definitely connect with me. You know, my podcast is the Mindworks podcast. They could follow me on Instagram. It's at Dre's Mindworks. They could definitely reach out to me through those outlets, and yeah, they could find me on at Mindworks Podcast as well on Instagram, and yeah, those are places where they can find me.
Okay, cool. I will put all of those links in the show notes, you guys. So, Dre, thanks again for being here. This has just been a great conversation. I appreciate
No,
it.
no problem. I hope to come back on. It was an interesting conversation.
Oh, yeah, definitely.
Take care.